Okay, this skill is performing perineal care of an incontinent patient. They're incontinent of urine. Knock, knock, knock. Hi, Miss Jones. My name is Jennifer. I'm your CNA today. I'd like to perform perineal care, get you cleaned up. I'm going to wash my hands and get my supplies. Washing my hands. My supplies are, some of them are putting my barriers down. Some people prefer to use paper towels as their barrier. You can use this or an incontinence pad. I'm going to close my curtain. Okay, I need a bath blanket, a towel, 2 washcloths, and a clean pad. I need a basin. I need soap. Gloves. You can put your gloves on anytime during the skill. Just make sure that you put them on before you start your patient care. This is a good time for me to put my gloves on, so I'm going to put them on. Make sure that you're checking the temperature of the water to make sure it's a safe and comfortable temperature. It should be warm. Don't multitask. Get your water warm, then get your basin under there. Don't hold your basin at the same time as you holding on to the faucet for the water. Turn my water off. Okay, Miss Jones, I'm going to move your call light. And I'd like for you to test the temperature of the water, make sure it's comfortable for you. You literally have to put your mannequin's hand in the water. Is that comfortable? Okay. All right, I'd like to raise the level of your bed, and you're not too close to the edge of the bed, so you're safe. Very important anytime that you adjust the level of the bed. Before and after you do so, you make sure your patient's not too close to the edge of the bed. Anytime you're moving them in the bed, you make sure that they're in a safe distance from the edge of the bed. You also need to make sure that the overbed table is not over your patient when you're raising the level of the bed, so you don't cause an injury. Okay. So Ms. Jones, I need to change that dirty pad that's underneath you. Would you prefer to roll on your side or lift your hips? Okay, you want to roll on your side? First, also, I need to put a bath blanket over you to give you some privacy and keep you warm. Anytime that you're opening a linen up over a patient, don't hold it up like this and open it. Just lay it on top of your patient and open it or unfold it on top of them. When I'm pulling the sheet down, I like to just pull it down to the knee area. And I'm going to pull the gown up to the belly area. So pull your sheet down, keep your feet warm. We'll pull your gown up to your abdomen to keep it dry. Okay, you said you want to turn on your side, so I'm going to cross your legs, supporting under your leg that I'm crossing. You want to cross this arm over your belly. On the count of 3, we're going to roll. Ready? 1, 2, 3. And take the dirty pad out.
Ms. Bergen, if you were on campus, please call 45502. Ms. Bergen, please call 45502.
I'm going to make a correction before I turn my patient. When I turn my patient over on their side, I would verify that they're not too close to the edge of the bed. Now I rolled her back, and she's still a safe distance from the edge of the bed. The first cloth I'm using is for washing, so I'm going to get it wet first. Make sure my gloves aren't drippy. I like to do this to make sure that I'm not going to make a mess of water all over the place. And whenever you're sloshing or just rubbing your soap around your washcloth, just hold over your basin. Don't hold it over here because you'll get drippy. Whenever you're doing perineal care, you have to change the spot on your washcloth for each swipe. Okay, Miss Jones, I'm going to uncover you. Change the corner of your washcloth. So I'm going to go top to bottom. Top to bottom. Changing the corner of my washcloth, going down the center. Making sure you don't go past the anus. And I'm going to fold this over the side. Using my rinsing washcloth. Make sure in between each wash, rinse, and dry, you cover your patient up. It's a privacy thing. It's a patient right. Okay, I'm going to rinse you now. Always go front to back. Don't get such a big hurry where it looks like you're not changing the spot on your washcloth. If you're going so fast and they don't think you're changing your washcloth, even though you are, you're not. Okay, Miss Jones, I'm going to dry you now. I'm going to uncover you. One. Down the other side. Down the middle. Okay. Now, I need to wash the back of you, so I'm going to make sure that I support under your leg. We're going to cross your legs again. And across your arm. First, I would ask, which side would you prefer to turn on? This way or that way? That way? Okay. Across your arm. Okay, on the count of 3, we're going to turn. Ready? 1, 2, 3. Making sure you keep your patient a safe distance from the edge of the bed. You're not too close to the edge of the bed. You're not going to fall. Don't dunk your whole washcloth down into the soap, into the water, because you don't want to make it too soapy. So I like to just put the edge in, the side, squeeze it out just a little bit. You put a little bit more soap on your washcloth. Because this is an incontinent patient, so you have to wash the bottom too. You have to change your spot. Okay, I'm going to wipe from the rectum upwards. So I'm going to do this side. This side. Up the middle. That was washing. You can put your whole washcloth in the water. And I accidentally just used my soapy washcloth for rinsing, so if my water is soapy, then I need to change it. So I'm going to wipe up this side. I'm rinsing you now. Side. And up the middle. Okay, now we're going to dry you. I'm going to dry up this side, change your spot. Dry up this side. And this is where, to keep from pushing your mannequin off the bed, just hold on to your mannequin while you're wiping. You can make sure your pad is nice and flat. Okay, we're going to roll back on the count of 3. Ready? 1, 2, 3. With a mannequin, you can kind of slide them over a little bit and it's not going to count against you. Your patient's not too close to the edge of the bed. I'm going to uncross your legs. I can pull the gown down. Pull the sheet up. I'm going to pull the bath blanket off of my patient. Anytime you take anything off of the bed of a patient, make sure you roll it up so you don't have anything that's dragging the floor. Straighten out what you can while you can. Makes it easier all the way around. And take my linens. put them in the dirty linen basket. I'm gonna pretend this is my dirty linen basket because I forgot to bring it in. Okay, now I need to get rid of my dirty water. My patient's not too close to the edge of the bed, so they're safe right there. Anything that you do from the waist down goes into the toilet. You know, dump it in the toilet. Make sure you don't get your basin too close so it looks like it's resting here. If it's resting or tapping, you need to make that correction. Instead of turning your water on and your basin over the sink and doing this while you're at the sink and the faucet, spill a little bit of water in your basin, swish it around without making a mess on the floor, pour it out. If there's a few drops of water in here, don't do that, because you just poured contaminated water into the sink. Do everything that you need to do that's considered dirty, like cleaning that dirty basin with your gloves on. And take your gloves off after you're done doing everything contaminated. Make sure that your table is dry. Put your equipment away. Taking my gloves off. Make sure you always take them off properly, grabbing the palm of your hand. Taking them off inside out. Wash your hands right away. Okay, Miss Jones, I'm gonna lower your bed. You're not too close to the edge of the bed. If you happen to run out of time on any of your skills, if you get the 2-minute warning, do the most important things first that pertain to patient safety. Lowering the bed, putting the call light in their reach. Would you prefer your table over you or next to you? Over you? Okay. Here's your call light. Would you like a magazine or a newspaper? Magazine? Okay. I need to open your curtain. Okay, I'm going to make any corrections now in case I didn't do it before. Before I raise or lower the level of the bed, I make sure that my patient is not too close to the edge before I start and after they're in their position. I offer preferences if she'd like to roll on her side or lift up her hips when I change the pad, and I offered a preference on which side she preferred to roll onto when I was doing the perineal care, cleaning her backside. And she has her call light. I lowered the level of the bed, offered preferences for magazine. I'm going to wash my hands again, even though I took my gloves off and I washed my hands. I touched a few things, so I'm washing my hands again, and I'm done.